Hey guys, today we are going to see about as I said, the core concepts about the facial nerve. Fine. So, facial nerve, as you all know, it is the seventh cranial nerve, and it supplies your second branchial arch. And there are a lot of nucleus associated with it, and it is one of the very important nerve. So it's okay to give it some time. Fine. So before going into what is the nucleus, what it supplies, and what is the clinical implications, I'm going to just give you a overall gist of what I have drawn in this year. Fine. So as you see, this is your midbrain, this is your pons, this is your medulla, and this is your spinal cord. Fine. What you see here is your lateral ventricle, and here will be your cerebellum. Fine. This is your brain stem. You can able to see your midbrain, pons, medulla, and your spinal cord. And this is your from ear to ear. This is your anterior cranial fossa, this is your middle cranial fossa, and this is your posterior cranial fossa. And you have your medullary cavity, you have your mastoid process, you have your styloid process, you have your parotid gland, you have your face, and you have your tongue, you have your sublingual, submandibular glands, you have your, this is your maxilla, and this is your and your orbit. Fine, this is your orbit, this is your maxilla, and this is your lacrimal gland, and you have some fossa here, you have some canals, you have some foramens, you have some ganglions. All this we'll discuss now. Fine. So this is what overall thing what I've drawn here. Fine. So if you look at the facial nerve, there are certain nucleus associated with it. Fine. So the first one, what I'm going to draw, the red one, is the principal nucleus. Fine. The principal nucleus of your facial nerve, which is nothing but your branchiomotor, or the principal nucleus of the facial nerve. Fine. So your principal nucleus of the facial nerve, or your branchiomotor nucleus, this basically what it does, it will carry your special visceral efferent fibers. Fine. This will carry your special visceral efferent fibers. So because it arises from your second branchial arch, it supplies your second branchial arch, it is also known as your branchiomotor fibers. Fine. So basically it will supply your muscles of the face and certain other muscles. Fine. Which we'll discuss here. And the next nucleus I'm going to draw in green. Fine. This is your parasympathetic motor fibers. Fine. Your facial nerve as motor and sensory. So your principal motor nucleus and your parasympathetic fibers, which is also carries your motor fibers. Fine. So that is your superior salivatory nucleus and your lacrimatory nucleus. So this superior salivatory nucleus and your lacrimatory nucleus, both are your parasympathetic motor fibers. Fine. So if you look at the your superior salivatory nucleus and your lacrimatory nucleus, both of them, they will carry your general visceral efferent fibers. Fine. So I'm going to just write it here. So both this superior salivatory nucleus and lacrimatory nucleus, they carry your general visceral efferent fibers. I hope you know what is efferent, what is afferent, right? So efferent is it from the CNS to the periphery, and afferent is from the periphery to the CNS. So the principal nucleus of facial nerve and your special superior salivatory nucleus and your lacrimatory nucleus. Fine. And this is your motor aspect of your facial nerve, motor fibers. And coming to the sensory fibers, a very very important fiber is your nucleus of tractus solitarius. Fine. Nucleus of tractus solitarius. This nucleus of tractus solitarius, if you see, it has a lot of functional components. So it has your special visceral afferent fibers, it has your general visceral afferent fibers, and it has your special somatic afferent. So if you look at the general visceral afferent, this gives your innervation to the soft palate. And the special visceral afferent, as I said, it's a very very important. It gives your taste sensation to the anterior two-thirds of the tongue. That's very very important, taste sensations. And this special sensory afferent, it is present in your optic nerve and your vestibulocochlear nerve. So as of now, it has your general visceral afferent and your special visceral afferent. This is very very important, nucleus of tractus solitarius. Fine. And the next one, I'm going to draw in blue. Okay. So the next one is the spinal nucleus of your trigeminal nerve. The spinal nucleus of your trigeminal nerve. So the spinal nucleus of the trigeminal nerve, it basically carries your general somatic afferent. Fine. So as we all know, the trigeminal nerve, it carries your touch, pain, and your temperature. And this spinal nucleus of trigeminal, it is also associated with your touch, pain, and your temperature. So it carries your general somatic afferent. And another one nerve which is not of much important is your dorsal nucleus of vagus. It carries your special visceral afferent fibers. Okay, fine. As of now, this is a very important nucleus which is associated with your facial nerve and their functional components. So you have your principal nucleus of facial nerve, which is your branchiomotor nucleus, and then your superior salivatory nucleus, your lacrimated nucleus. You have your nucleus of tractus solitarius. You have your spinal nucleus of trigeminal nerve. So all these are your functional components, and we will see how this is associated with the brainstem and how it reaches the destination. For example, if you take your principal nucleus of a facial nerve, as I said, it is your motor fiber. So it has to originate from the brainstem and it has to supply your muscles of face and few other muscles which I will discuss. And for example, your superior salivatory nucleus, it gives your secretomotor pathway to the submandibular and sublingual glands, and your lacrimated nucleus, it has to reach your lacrimal gland present here, and your nucleus of tractus solitarius, it has to reach the tongue because it gives a taste sensation to the anterior tooth of the tongue, and your spinal nucleus of trigeminal nerve, which will reach somewhere around here, posterior auricular region. So we will see how it originates and how it reaches, or how the fibers from the periphery reaches the central nervous system. Fine. So as I said, efferent is from the CNS to the periphery, and afferent is from the periphery to the CNS. Fine. Okay. Now, first we shall we shall talk about your principal nucleus of the facial nerve. Fine. So, as I said, this is your midbrain, pons, medulla, and your spinal cord. Fine. So your principal nucleus of the facial nerve, it will be somewhere here. It will be in the lower aspect of your pons. It will be in the lower aspect of the pons. And what will happen is, any fiber, it will move forward in a sense, that is, it will move in this direction. Fine. This nucleus, this principal nucleus of the facial nerve, it has one peculiar characteristics, that is, it will first move backward. I will tell you that this is a tent, right? This is a lateral ventricle, and it thinks that I can stay here, so it moves towards the tent. But the tent owner said, no, only 6 people are allowed, and you are being the 7th one, you are not allowed. And now what happens? It goes there and it turns, because there is no place for it to stay there. It turns around and it exits via your pontomedullary junction. So this is your 6th nerve. This is where your abducens nerve will be located. So it goes backwards and it takes the bend and it exits via your pontomedullary junction. So while doing this, it forms a groove. It forms some elevation here. Can you able to see this? This is your elevation which is formed by this, and this is known as the facial colliculus. What is it? This is known as your facial colliculus. Fine, this is known as your facial colliculus, and it exits via your pontomedullary junction. Just keep this in your mind. And if you look at the superior salivatory nucleus, as I said, I will draw it in green. It will be somewhere here, and the superior salivatory nucleus, it will move forward. Fine. And your similarly, your lacrimatory nucleus, it will move forward. And your nucleus of tractus solitarius, it will be somewhere here. Fine, it will move here. And your spinal nucleus of your trigeminal nerve, it will be somewhere here. So see, all this bundle of fibers, except your motor root, this bundle of fibers, they are known as the nervous intermediates. This group of fibers which comes out and except your principal nucleus of facial, these bundles, they are known as the nervous intermediates. Some textbooks say that it is a sensory root, but always remember your parasympathetic motor fibers, that is your superior salivatory nucleus and the lacrimated nucleus, are also present in your nervous intermediates. Fine. Okay. Now, all these fibers, they enter a canal. This one. This is known as the internal acoustic meatus or internal auditory meatus. Fine. So what is this? This is your internal acoustic meatus. So all these fibers, they enter the internal acoustic meatus. They are, grouped together, or they have their friendship at least for a few distance, and all these, they enter your internal acoustic meatus and they reach their respective destinations. Okay, now we shall see about each fiber. So first, if you see the principal nucleus of the facial nerve, it enters your internal acoustic meatus. Fine. And it passes to the, what aspect of this? Your internal acoustic meatus is the one that connects your brainstem to the medial wall of the ear, medial wall of your middle ear. So okay, now before going into this, just look at this. This is your middle ear cavity. Fine. So I have removed a wall here and the top box. So I have removed the roof and your, what is this? This is your lateral wall. So I have removed the lateral wall and I have removed the roof so that I am able to see what is this wall. This is your medial wall. Fine. This is your medial wall, and this is your anterior wall, and this is your posterior wall, and this is your floor. So what happened? I removed your lateral wall and I removed the roof so that I can able to see the medial wall. This medial wall and this posterior wall is very, very important aspect as far as the facial nerve course is concerned. So this brachiomotor nucleus, the principal nucleus of facial nerve, they enter your internal acoustic meatus and they reach your antero-superior aspect of the medial wall of the middle ear. Can you get it? Antero-superior aspect of the medial wall of the middle ear. And very important thing is they form a bend here. The first bend is here, which forms a facial colliculus, and the second bend is here. And because of this, they form a ganglion. So geniculate ganglion. What is this ganglion? This is your geniculate ganglion, because genu means bent. Fine. Geniculate ganglion. Fine. Genu means bent. So once it enters the geniculate ganglion, it will just flirt with the geniculate ganglion and it will move, and it will not have any synapse with the geniculate ganglion. I will say what nerve fibers or what bodies are present in your geniculate ganglion. So this moves around the geniculate ganglion and it enters a very important canal. Fine. It enters a very important canal, which is nothing but your facial canal, the bony canal. So once it enters, this enters your bony canal, which is nothing but your facial canal, and it moves downwards, and it enters your it moves backwards, and it enters the posterior aspect of the middle ear, and it goes downwards, and it exits via your, what foramen is this? It is present between your mastoid process and your styloid process. It is your excellent stylomastoid foramen. This is your stylomastoid foramen. So your facial nerve goes backwards and downwards, and it exits via your stylomastoid foramen. And then what happens? This stylomastoid foramen, once it enters, and it will enter the posterior aspect of the parotid gland. Within the parotid substance, they divide into 5 terminal branches. Fine. Okay. Now, before this facial nerve, it enters the bony canal and it goes down. And here, if you remember your middle ear anatomy, you have your incus, malleus, and stapes. Fine. This incus, malleus, and stapes is very, very important, because your stapes is a bone which it controls the excessive vibrations, and the muscle which helps it is your stapedius muscle. Fine. So your facial nerve, it gives the first branch to the stapedius muscle. The stapedius muscle, for example, your stapedius muscle is this, and it gives attachment to the stapes. And your this is very, very important, because once this muscle is damaged, or this aspect of the facial nerve is damaged, there will be excessive vibrations, such like I cannot even talk in the mobile phone, because excessive vibrations will be really disgusting. Fine. So this is very important, nerve to stapedius. Fine. So the first branch is the nerve to stapedius, It supplies your stapes, and it supplies your stapedius muscle, and which will prevent the stapes to excessively vibrate. And once it comes down, it gives off your branch to the posterior auricular, and then it gives off your nerve to styloid, and then your posterior belly of digastric. Fine. So, and then it enters your parotid gland, where it divides into 5 very important aspects. So the first one is your temporal branch. Fine. It supplies your occipitofrontalis, corrugator superci, and your orbicularis oculi. So your temporal nerve supplies your occipitofrontalis, it supplies your corrugator superci, it supplies your orbicularis oculi. And the next branch will be your zygomatic. Zygomatic also supplies your orbicularis oculi. It supplies your zygomaticus minor, zygomaticus major. It supplies your, levator labii superioris and your allecinaceae. Fine. So, and then if you look at the next is your buccal, which supplies your buccinator muscle. Fine. And then it also supplies your risorius muscle somewhere. It also supplies your risorius muscle. And if you look at your marginal mandibular, it supplies your mentalis muscle, it supplies your triangularis, this one is triangularis, and this is your depressor labii inferioris. And if you look at the cervical branch, it supplies your platysma, and as I said, this is not supplied by your terminal branches. What is this? This is your posterior belly of digastric. This is not supplied by your terminal branches. This is supplied by a separate branch which arises once it exits your stylomastoid foramen. Okay, don't confuse your posterior belly of digastric. It is not supplied by your terminal branches. So I hope it makes you a little sense. So your principal motor nucleus, they take a first bend which gives a facial colliculus. It exits your brainstem and it enters your internal acoustic meatus. That forms a second bend where it passes through the geniculate ganglion, and then it moves backwards and downwards into the posterior aspect of middle ear, and it exits via stylomastoid foramen, and where it gives rise to your posterior auricular branch and your styloid and your posterior belly of digastric. Within the substance of the parotid, they divide into your 5 terminal branches. So see, I want to make sure that this posterior auricular it gives off once it exits the foramen, not here. Once it exits, okay, once it exits, it gives off the branch to the posterior auricular and your styloid and your posterior belly of digastric, and then your terminal branches. Fine. So this is a very important aspect, and okay, fine. Now, let us move to the parasympathetic fibers, parasympathetic motor fibers. What are they? They are your superior salivatory nucleus and your lacrimatory nucleus. Fine. So first, if you see the superior salivatory nucleus, it exits, it enters the internal acoustic meatus, and it enters into your geniculate ganglion, and it moves backwards. Whereas your lacrimatory nucleus, it also enters your internal acoustic meatus, and it also enters your geniculate ganglion, and once it enters geniculate ganglion, it comes out and it enters the middle cranial fossa, and it goes into this foramen. What is this foramen? It is a lacerated foramen. I hope you have got it. This is your lacerum, foramen lacerum, and it enters the foramen lacerum. Fine. So if you remember, your foramen lacerum also carries your internal carotid artery. So it also carries your internal carotid artery. So I'm going to draw internal carotid artery here, and this internal carotid artery also has some sympathetic fibers surrounding it. So this sympathetic fibers, fine. These sympathetic fibers, along with this lacrimatory nucleus fibers, they enter into a canal. Fine. They enter into a canal, and they reach your certain fossa. What is this fossa? Present between your orbit and maxilla. This is your pterygopalatine fossa. This is your pterygopalatine fossa. Fine. So this enters your pterygopalatine fossa, and it and rests on a ganglion. What is this ganglion? This is your, as the name implies, this is your pterygopalatine ganglion. So once it reaches the pterygopalatine ganglion, it has to reach the lacrimal gland. This is your lacrimal gland. As the name says, lacrimal nucleus supplies your lacrimal gland, right? So it has to reach the lacrimal gland. Okay, fine. Now, once it enters the geniculate ganglion, I said it does not go through the facial canal. It leaves it and it enters your middle cranial fossa, and this branch, this aspect of the nerve is your greater petrosal nerve or greater petrosal nerve, whatever you pronounce. So this greater petrosal nerve, it enters the foramen lacerum, and I said, if you remember, they are joined by your sympathetic fibers surrounding your internal carotid artery, which is nothing but your deep petrosal nerve. So this greater petrosal nerve plus your deep petrosal nerve, they enter into a canal which is nothing but your nerve to pterygoid canal. Very important MCQ question. Nerve to pterygoid canal. This is nothing but your, otherwise known as your Vidion nerve. So this greater petrosal nerve joins your deep petrosal nerve, enters into the nerve to pterygoid canal or Vidion's nerve. They reach your pterygopalatine ganglion. From this ganglion, this deeper petrosal nerve, they pass through the ganglion, and this your greater petrosal nerve, it has to reach your lacrimal gland. Fine. So from here, what it does, it has to find some nerves which supply your lacrimal gland. As we all know, it is your lacrimal nerve. Okay, fine. If you remember, okay, it was, you have your ganglion. You have your ganglion here, middle 24, so which is nothing but your trigeminal ganglion. Excellent. You have your three branches: your ophthalmic, your maxilla, and your mandible. So you have your ophthalmic, maxilla, and your mandible. Fine. So this ophthalmic, if you remember, it gives rise to your nasociliary nerves, your frontal nerves, and your lacrimal nerve. Fine. This lacrimal nerve, it reaches or it supplies your lacrimal gland. So this greater petrosal nerve has to reach this lacrimal nerve. Fine. So if you remember the maxillary, it enters via foramen rotundum and it gives rise to a branch called zygomatic. Fine. So this greater petrosal nerve, from the pterygopalatine ganglion, the postganglionic fibers arises, and it first it jumps to the zygomatic nerve, and then it jumps to the lacrimal nerve, and along with it, it supplies your lacrimal gland. Lacrimation. It is responsible for the lacrimation. Now, this is a very important secretomotor pathway of the lacrimated nucleus. So the lacrimated nucleus, it goes into geniculate ganglion. It does not synapse there. It just passes, and it goes to the middle cranial fossa, passes via foramen lacerum, and joined by your deeper petrosal nerve, where it forms your nerve to pterygoid canal or a Vidion's nerve, and it enters your pterygopalatine ganglion, and from this ganglion it passes with the help of a zygomatic nerve, which is a branch of the maxillary nerve, and your lacrimal nerve, which is a branch of ophthalmic nerve, and it reaches the lacrimal gland. Fine. It also, in addition to this, it also supplies some of your nasal glands and your palatal glands. Fine. In addition to the lacrimal, it also supplies your nasal and your palatal glands. This is additional. Maybe in the future MCQs, they might ask you. So what are the things which is supplied in addition to the lacrimal gland? Okay. So just remember, it also supplies your nasal and your palatal glands. Okay. Now, if you look at the next one, the salivatory nucleus, superior salivatory nucleus, as I said, it enters the geniculate ganglion, and it goes backwards and downwards, but it does not exit your stylomastoid foramen. Where has it gone? Some magic has occurred, right? So what it happens is, there will be a canal here. There will be a canal in this bony cavity. This canal is known as posterior canaliculus. Fine, very easy, right? It is in the posterior aspect, and there is a canal, posterior canaliculus. So it enters the posterior canaliculus and reaches your medial wall of the middle ear, and it exits via your, there is some fissure here. What is it? This is your pterygotympanic fissure. Pterygotympanic fissure, and it enters your infratemporal fossa. This is your infratemporal fossa, and what it has to do, it supplies your submandibular gland and your sublingual gland. So it has to reach, it has to catch some nerve which supplies it. So as we all know, your mandible via your foramen ovale, this mandibular nerve enters, and it gives a lot of branches, and one of the branches is your lacrimal nerve which supplies your tongue. Fine. So it catches your lacrimal nerve and it rests in your, what is this? Ganglion. What is this ganglion? From this, the postganglionic fibers carries your submandibular and your sublingual. What is this ganglion? This is your, excellent, this is your submandibular ganglion. This is your submandibular ganglion. So once it reaches the submandibular ganglion, the postganglionic fiber supplies your submandibular and the sublingual glands. Fine. So your superior salivatory nucleus, it enters and it goes backwards and downwards, but it does not exit via your posterior canalicus. It enters the medial wall of the middle ear, and it exits via your pterygotympanic fissure, and it enters the infratemporal fossa, and from there it rests on a submandibular ganglion, and postganglionic fibers arises and supplies your submandibular and sublingual glands. Fine. Okay. Now your next one is your very important nucleus of tractus solitarius. It is very simple. Always remember, because it is an a special visceral afferent, I have to go from ear. Fine. But for for your understanding, I am coming from your central. Fine. So it follows the same pathway as your superior salivatory nucleus. It enters your internal acoustic meatus. Fine. It enters your geniculate ganglion, and it passes similar to your superior salivatory nucleus, and via your posterior canalicus it enters and exits, and it joins the lingual nerve, and it supplies your anterior 2/3 of the tongue. Fine. What is this? What is one of the important thing is geniculate ganglion. As I said, all these fibers, they just flirt, they just pass through this ganglion, but this nucleus of tractus solitarius, it synapses with the geniculate ganglion. So by this we can conclude that this geniculate ganglion are cell bodies of your sensory neurons of your nucleus of tractus solitarius. You have your parasympathetic ganglion, your sensory ganglion. The parasympathetic ganglion, as I said, it is your ciliary ganglion, your optic ganglion, your submandibular ganglion, and your pterygopalatine ganglion. So this is your sensory ganglion. Fine. So another one important thing is your anterior 1/3, the taste sensation is supplied by your, exactly, your what is this, nucleus of tractus solitarius, and then for example, your glossopharyngeal, your vagus, all these which supplies your taste sensation to the tongue, they have to have your nucleus of tractus solitarius, because this is the one that supplies your taste sensation. Fine. This is self-explanatory. Fine. Okay. Now what I have left. Okay. The nucleus, your spinal nucleus of trigeminal. As I said, the spinal nucleus of trigeminal carries your pain, temperature, and touch. So it enters this is your your spinal nucleus of trigeminal. It enters your internal acoustic meatus. Fine. It passes through the geniculate ganglion, and it enters the bony canal, and it exits via your stylomastoid foramen. Fine. It exits via stylomastoid foramen, and it goes backwards, and it supplies in the posterior auricle region. Fine. So as I said, these are all the very important aspects. The first being a motor nucleus. It goes here, enters geniculate ganglion, and it enters your stylomastoid foramen, supplies the terminal branches of the facial nerve. Your superior salivatory nucleus enters your internal acoustic meatus, passes the geniculate ganglion via posterior canalicus, reaches your middle wall of the middle ear, and via your pterygotympanic fissure, it enters your infratemporal fossa and reaches submandibular ganglion, and it supplies your submandibular and sublingual lacrimal gland. Rather than passing through it, it goes inside the middle cranial fossa and passes inside your foramen lacerum, and it joined by your deeper petrosal nerve, and this forms your nerve to pterygoid canal and reaches the pterygopalatine ganglion, and there it reaches this lacrimal gland via your zygomatic and your lacrimal, which are which are your branches of your maxillary and ophthalmic nerve respectively, and it also supplies your nasal and palatal glands. If you take your nucleus subtractus solitarius, it is very similar to the superior salivatory nucleus pathway, but it synapses with the geniculate ganglion, which is a sensory ganglion. Fine. And your spinal nucleus of trigeminal nerve, which gives your touch, temperature, and pain to your posterior aspect of the ear. Okay. Now this is your core aspects of your facial nerve. And if you look at the applied anatomy, there's nothing very important is your Bell's palsy. It's caused by your herpes simplex type 1 virus. Once it is reactivated, your immune cells attacks your facial nerve, and it is obviously going to cause some certain problems. Your drooling of saliva will be affected, your drinking problem, your patient will be unable to smile, and then your hyperacusis if your nerve is damaged at the level of stapedius, as I said. So these are all the few problems that can arise once you have your Bell's palsy. And then you have your Lyme's disease, you have your sarcoidosis, otitis media. So otitis media, this is a very dangerous thing. If you left, it can result in brain abscess and meningitis. So as far as the facial nerve is concerned, this is the core aspects of the facial nerve, and most of the MCQs will be covered if you know this aspect of the facial nerve. The main thing is your functional components, your nucleus, and your ganglions. Fine. So I hope you get a gross idea of what is facial nerve, and I'll be posting some MCQs related to the facial nerve in my Instagram page. And if you can get this video, I think you'll definitely able to answer that. Okay. Thank you for watching this video. Thank you. Have a great day.